Hi, I'm Deborah. In this video, I'm going to discuss 3 common behaviors that you might see in someone with depression. And hopefully in understanding these behaviors, it'll help you understand the person that you know who has depression and I guess just how to live with them and how to live with the depression. Note that this isn't like a checklist or a diagnosis. This doesn't say that if someone has these three behaviors that they have depression. Everyone with depression is different. Everyone's depression is different. And in fact, if they have different bouts of depression, they might have a couple of these behaviors one time and have none of them the next time. So, just as a caveat, this is just this is not for diagnostic purposes. It's just for informational purposes. So the first one is what probably seems to someone who has never had depression, or even someone who is new to depression, as laziness. But I would call it lethargy. So from the outside, you see someone who, if you live with them especially, they're not doing their share of the household chores. They may be putting in minimal effort at work. And, especially if this is someone who normally seems to have a lot of energy, you may not understand what's going on. Clearly, it's going to be frustrating, especially, at home, if you're counting on them to get things done, and you don't understand what's going on, and they may not understand what's going on. But the way I can, the thing I can really compare it to is if you're really sick, like you have the flu or something, and really, just getting up to go to the bathroom can seem almost insurmountable. You just have absolutely no energy. And it's not really physical energy, although it may feel like that to the person with depression. It's actually mental energy, but it just sometimes translates into, an actual feeling of heaviness in your limbs. So I understand it's frustrating. I have depression. I've had it for many years, so I've been on that side of it. But I've also been on the other side of it when I was living with someone who was suffering from depression. I had an hour-and-a-half commute each way to work. He got out of work at 4:30 and was home 10 minutes later. And I'd come home, late after fighting traffic for an hour and a half, walk in, and he would have been home for 2 hours. And the dishes that were in the sink that morning were still in the sink, and he was just lying on the sofa. And I was pretty frustrated, even though I, understood depression and had experience with depression. So I totally understand that this is frustrating. And, this doesn't mean that you should just give up on trying to get the person to do their fair share of chores. It's just that, what you want to do is be understanding, say, hey, I understand that this is more of an effort for you than it used to be, or I understand that this is an effort, but this really needs to get done. And, don't just give them a pass, because the problem is then the work is on you, and there's no reason that you should take everything on you. But just understand it's going to be more of an effort for them than it used to be. The next behavior that I want to talk about is withdrawal. And this is obviously emotional withdrawal. So, you may be getting very frustrated because the person seems not only withdrawn, but very kind of inwardly focused. Like really all they're really paying attention to is their needs, their feelings, and, they've withdrawn emotionally. And this can be very hard on a relationship, no matter what kind of relationship it is. And you may get a blank stare from them when you tell them that they've been really withdrawn emotionally, or that they just seem to be really selfish. This is something that is pretty common with depression, and it's just a function of the depression. I suffer from some medical problems that cause me a lot of pain, and it's very much like that. So if you have any kind of problem that, or you've been in intense pain before, you may understand what it's like, that the pain really makes it hard for you to focus on anything else. It's very similar to physical pain in that the depression just completely pulls all their attention. And so that's why they seem to be completely self-absorbed. And so there's that aspect of the withdrawal. The other aspect is that they really might be feeling emotionally numb. And this doesn't necessarily have anything to do with you. Don't take it personally. It doesn't, though sometimes people with depression can say, I don't feel the same way about my spouse or my partner. If they don't realize that they are depressed, or they don't realize this is an aspect of depression, they may just feel that they've lost interest in the relationship. So that's something that I always have pointed out to people, especially people who have emailed me and have said, I think I'm just going to divorce my spouse, or leave my spouse or my partner because I just don't feel the same way. And I tell them, don't do anything until you are being successfully treated for depression, because I will bet you almost anything that you will feel differently. So that's one of the problems, is that there is frequently an emotional numbness, and it can be very hurtful to the person that's on the other side. It can be hurtful to the person who with the depression, because it's very sad for them. They don't want to feel that way. But obviously it's hurtful for the person who's on the other side. It's very painful. So that's something that if you see this person is doing that, they may not acknowledge that they feel emotionally numb toward you or toward the relationship. So that's something that you want to draw out of them and have them talk about. And this is something that, if the person hasn't been diagnosed with depression, you definitely want to push them to get diagnosed, because otherwise they could make a decision about your relationship that essentially could be irrevocable. It might help to remember that this is not something they're deliberately doing. This is something that's happening to them, both the withdrawal and emotionally, and just the withdrawal into themselves. And remember, if they're suffering, especially from major depression, every minute is just a struggle, every single minute. And that's also why they may seem inward, because they're really just have this Sisyphean task of struggling through life, minute by minute, hour by hour, day by day. And so it's something that takes a lot of their emotional energy. And then the third behavior I want to talk about is negativity, or someone being very critical. I was diagnosed with depression at age 27, and I grew up with people, telling me, you're really negative. And I didn't see it that way, because I had no idea I had depression. I didn't know any other way to be. So for me, this wasn't particularly negative. It just was. When I got treated, turned out I'm actually one of the most positive people that you could meet. I actually have friends who come to me for some comfort when they're going through a bad time, and just say to me, please stop looking for the silver lining. I just want to vent. And I'll say, oh, I'm sorry, but that is my automatic reaction. Actually, my personality is to be very positive and always look for the upside. It's completely different to how I was when I had depression. So just understand that this negativity probably is coming from the depression, especially if this is not how the person used to be. This is not a choice they're making to be negative about things. It's not that they enjoy being negative. and especially if they had been a positive person in the past. I guess one way to explain this negativity is it's really the opposite of rose-colored glasses. So you're seeing everything through this film of depression. Everything that they think about their life, about their job, about you, about everything is just kind of, it is just colored by the depression. So that kind of also leads to the person being critical. So obviously if everything to them seems just basically bad, they have depressive thoughts all the time about how bad life is, how horrible the world is, just about everything, then what comes out of their mouth is going to be critical a lot. So don't take it personally. Also, don't try to talk them out of it too much. I know this sounds funny, but sometimes to people with depression, someone who's really cheerful and happy and bright smiling face, especially if it's fake, is just really irritating. So obviously you don't have to fall into the same hole they're in. You don't have to be negative, but just understand that this isn't making them happy to feel this way. This is making them miserable. So you don't have to take verbal abuse. So if they're being critical, nitpicky or something, just ignore it. But obviously if it goes into verbal abuse, then that's not something that's acceptable, because that's a completely different thing. I think that one thing you can do is if you're a positive person and that's your default, just keep being positive. You don't have to tone it down for them. Just don't fake it. Don't try to just be jolly and cheer them up and everything, because just your example of being positive is might be enough just to make them feel a little better. So I hope this video has been helpful in helping you to understand someone with depression a little better, through these 3 common behaviors. If you have any comments you want to make, please leave them below. We'd love to hear anything that you have to say, any experiences you've had with someone with depression. And we'll see you next time. Be well.